Welcome back to Health Law Pulse, the podcast where we explore the intersection of healthcare, leadership, and law. I'm your host, John Rhodes, healthcare attorney and founder of Health Law Council, LLC. Healthcare organizations are under constant pressure to do more to improve quality, reduce costs, integrate new technologies, and adapt to an ever-changing regulatory environment. But having a great strategy is only part of the equation. The real challenge is execution. How do you align physicians, executives, IT teams, and operations around a common goal? How do you implement enterprise-wide technology without disrupting patient care? And how do you build systems that not only improve efficiency, but also support better clinical and financial outcomes? Today's guest is Melissa Corneal, a healthcare operations and program management executive with extensive experience leading enterprise transformation across complex health systems. Throughout her career, Melissa has overseen large-scale EHR implementations, CRM integrations, AI-enabled workflow optimization, and operational redesign, helping organizations bridge the gap between strategy and execution. In this episode, we discuss what successful transformation actually looks like, why alignment across clinical, operational, and financial teams is so difficult, and how organizations can leverage technology while maintaining strong governance and operational discipline. This is Health Law Pulse. Melissa, thank you. Thanks for joining us for another episode of Health Law Pulse. I know you're very busy, and I appreciate your valuable time.
Thank you for having me here. I'm very excited.
Yeah, I've been looking forward to this discussion for a while because you bring in a very broad background in healthcare operations and overseeing major projects, and so I'm looking for your expertise and sort of how that connects with the compliance world, with the clinical world, and everything that you've been a part of during your career. So, Melissa, do you mind if we just get started? I think it'd be helpful context for the questions that I'll ask and some of the discussion that we'll have. Giving us a little bit about your background, what you're doing now.
Yeah, of course. So now I am an operational program manager for a large MSO in the state of Florida. We have just 49 offices. So we have just under 100 physicians, and we've rolled out a new EHR in March. Simultaneous projects, actually. We have a CRM that we've rolled out at the same time. So eClinicalWorks, and a new one for Lead Squared, which replaced Salesforce. I was recruited out of grad school at UF Health here in Florida and been working in healthcare ever since. So that's what I've been doing for the last 10 to 15 years.
Excellent.
Yeah.
Excellent. And a lot of different roles. So this is going to be good. I kind of want to start there, Melissa, with you've been part of many leadership teams, and I know that part of that is strategy, right? We start with strategy. What is our strategy? How do we operationalize that? How do we execute that within the healthcare system environment? You've led enterprise level transformations. What do you think is the biggest gap between those two very important steps, the strategy to execution in the healthcare space?
So I am in project management. And I think that it is, well, really what we're talking about here today, right? Is that that execution. How are we going to make what we have on the page and happen in real life? The implementation part of it. How do we make that happen with our team? And we as leaders are going to lead by example, I think, and present that really strong plan and make sure that we have all of those steps in place, have the strong leaders, have the talks, and make sure we have it as easy as possible. We're always going to hit roadblocks. But again, I think a project plan that is just as easy to follow as possible is always going to be the fallback position.
Yeah, and is that so just to clarify, transformation efforts, just for everyone listening, like for me, I'm thinking, and I've had many clients that have transitioned to different EMRs. The bigger you are, the more complicated that gets, or different clinical offerings or things like that. So is that the in these sort of transformation projects and efforts, is that the most common breakdown? Is it not necessarily planning enough, not having anything communicated enough, written down? What is it that most commonly breaks down?
So I would say in every project, in every EHR, we're talking electronic medical record right now, or health record is what we're discussing. And there are going to be problems, small and big, along the way, right? So, and most common, everything is going to go wrong along the way. And what is going to go wrong is going to be your data migration is going to be a problem. All of the data is not because in a lot of ways, and this is something that I learned really early on in my career. And if you think about it, this is sort of how we used to explain this because I'm in administration, right? So that means I'm not a clinician. No, not a problem. I have no problem saying that because and a lot they're much smarter than I am, right? So I would have to explain to a room full of doctors, you have everyone in this room maybe has an iPhone or a Samsung. What I'm going to do is make them talk to each other. I'm going to have these phones start communicating, but on the inside, they look completely different. And that, in a way, is what an electronic medical record does. If you're going to talk to someone who doesn't really understand what computer does, they maybe can rewire your heart, but they can't understand maybe what a computer does. And that was really the baseline for understanding how our electronic medical records coming online. And so data migration, huge problem. That's like, we have all of these labs coming from all of these different places. How do we make them say the same thing once they're getting to this new record on the other side? So that's going to be your number one problem because if, like John, you or Melissa, me, patient A, patient B is coming from one doctor's office or another, and then we get them over here and it says something different, then that data is not good at all. So, at the end of the day, what are we doing? Right. So I would say that would be a huge risk for us.
Yeah.
You know? Yeah.
Yeah. No, that makes sense. It's really consistent with what I've seen in the past too.
Yeah.
And the interesting thing to me is I've had a number of physician leaders on the podcast, and we've talked a little bit about what um the clinical perspective of administrative transformations or decisions or projects, things like that, which is really interesting. But there are a number of perspectives that are really important, and you worked with over your career in a very much a multidisciplinary format, right? So you've got folks from legal, compliance, yep, the clinical side, operators, finance teams, IT leaders, all aligned around that strategy, whatever the strategy that's developed. So then it's the challenge of, and I'm really interested in your expertise on this. It's the challenge of every one of these leaders from different areas of the health system. They have different. There's an overarching uh, goal and
And there's
column, and everyone wants the health system to do better and to take better care of patients, but they all have their own interests in terms of their own areas over which they have responsibility. So it creates probably some to a certain extent natural tension. So what does the how do you overcome that barrier to get from strategy to execution and try to bring everyone in line? What does true alignment look like across
yeah,
all these stakeholders?
that's a great question. So my first real boss out of graduate school, and I was very fortunate to have him. He was the CEO of that hospital at the time, of Flagler Hospital. It's
Mm.
now UF Health here in St. Augustine. Um, he is the one who hired me, and I kind of became. I mean, there was somebody between us, but he was really my boss, and he was a visionary. And so, one of the things that I had to learn, early on was, um, what are the things that I need to make actionable now? What are the things that are actionable in 6 months? And what does it look like in 12 months? Because they're all important, but what does that timeline look like? Because everything he said was something that belonged on a timeline, but just where does it belong? Does that make sense?
Yep.
And so that was something that I really got to learn. And while I also, I remember I was my first week there, he called me into his office and he put the phone on mute. And I all of a sudden found myself in a conversation about implementing an EHR. We're talking millions of dollars. And he said, I brought Melissa in here to talk. He's talking to this person on the phone and we want to get her take on this. And I said, excuse me, put it back on mute. He said, I'm in no way prepared to answer this question. And he said, this is the pool. he said, either jump in and swim or get out.
Yeah.
And so swam.
Yeah. That's great. That's great. That is good advice for sure, and it certainly uncomfortable position to be in at the time, but see how that helped you to grow and uh, uh, and develop in your career. So, what role do you think then? I think this is actually a great example of of what you just shared with us. What role does leadership playing in driving that alignment? Where does it fall short? What role does that play?
Let me have you rephrase that question because I feel like I'm there on the verge of something really important. I want to make sure that I answer it fully. Go ahead. Would you mind rephrasing that for me a little bit more?
So, I think we all, in a transformation or in a big project within the healthcare system, there are a lot of cogs and wheels. We all have our different roles and responsibilities. And as I think what you're describing is that a leadership, wherever it comes from, um, plays an important role in that alignment and getting towards the common objectives. So, what role does that play? It may are there areas where that maybe it falls short in your experience?
Well, I'll tell you one thing that I did learn also in that role before, and I learn every day also before I will say what falls short is I'll say that I learned something about never miss a good opportunity to be quiet, which is everyone around us is a time to learn something. And I really learned that so much. And I learn that every day, actually. Um, whether I'm around my daughter, whether I'm at work, it's really, I have to say and I started learning that, crazy that when I left school, but, I would watch my mentors and they were absorbing every bit of the questions and information that was around them in a way that I had not seen other people doing it. And and I still see that to this day. Like I really have appreciated that about great leaders that I've been around and fortunate enough to be around. So where does it fall short? I think that not having the right people in the room can make it fall short, and I find that to be unfortunate. So if I find that the right people are not in the room, I try to get them there. So that is something that I'm, still rounding out my eClinical works. Uh, implementation right now. So I said there's 50 practices. We're coming off of a Greenway system. And I have to mention before that, this practice that I work with now, they were on paper. They were on paper for almost 30 years.
Oh,
Okay. And they were on Greenway for like, I think a year. So this is not, they call them legacy providers. So this is a serious paper practice situation here. 100 providers, all of that. This is an undertaking is what it is. And so I'm making sure we have the right resources. I mean, we've been working with the CEO of eClinical Works, the vice president. We've got the best of the best. It's really an exciting time. So I feel really fortunate to be working.
yeah, that is such a great point. It is, and it's so in my experience, it's so obvious when the right people are not in the room. It naturally comes up when you're asking questions, right? And then you can say, well, no one here can answer that. We need X, Y, and Z here with us. It's such a critical part to any success of that magnitude. So as we go along, sort of this journey here, we talked about alignment, we've talked about operationalizing that, some of the struggles and challenges with that. What once organizations achieve alignment, they operationalize it. A lot of time that comes through technology, workflows, enterprise systems. You've led large scale EHR, CRM implementations. And I think there's some level of risk to anytime we scale, depending on the speed of the scale and the scope of the scale. But what are the biggest risks in designing systems at that level, at that scale?
Well, I think what are some of the I think the largest risk that I've seen is choosing the wrong system at the beginning. That
Sure.
would be a huge risk. And I've seen that happen. And for example, Some of the systems out there, if we want to talk about EHRs, they have been repackaged and repurposed and sold under a different name. And so that would be like, having like a Kia and then slapping a different name on it. And now we're calling it a Ford or something like that. And I'm not nothing against either car. It's just, you thought you had a Ford, but you actually have a Kia situation, you
Right.
know, um, and that can cause a lot of problems down the road, especially if you want to work with somebody who only has Fords.
Yeah.
Um, and that has created just a whole bunch of different issues that I've seen. So I would say that initial investment, if you are not 100% sure in what you're investing in, then that is your biggest risk.
And what are some, we obviously don't need to go into specific EMRs, but what are some, how does a healthcare organization know at least what direction they should go to in terms of selecting? I mean, let's just use the EHRs as an example. What should they be looking for?
So, um, it depends what their healthcare system is. I think, if they're a hospital-based system, there's gonna be some uh, obvious choices, I think, out there. Are they integrating outside of the hospital as well with their provider practices? Is that going to be something that they need to consider? Or are they just going to be inside the hospital? These are considerations. Are where I am, for example, right now, we don't we're only we're I mean, we do get information from hospitals. However, we are those physician offices. We're 50 offices. We do integrate with labs, but these are our main focus is the outpatient facilities. So the hospital systems come in a different way, if that makes sense. So I think what it is how do we want to receive and view our information? What is our main focus and revenue stream? And once we have that, where do we see ourselves growing in the next 10 to 15 years, because we don't want to change it. That would be, if we're not changing. What are we going to be looking at in the next 10 to 15 years? And once we know that, then we know what we can build towards.
Right. So it sounds to me like designing those workflows first, right? And building the system or selecting the systems that are aligned with
Yeah,
those flows.
you really got it there. And what you want to do is you really want to have those right people in the room. You really want to go, you don't want, you want to, the demos, you want to go talk to people you trust. You just go, I mean, more than a test drive. This is a big investment of time, resources, money, just everything.
Yep,
Mm.
absolutely, absolutely. So speaking of systems, we're talking about implementing systems, but honestly, Melissa, there isn't a day that goes by that I don't have a discussion with a client about AI in some capacity. Or it's, there's clinical decision support software, whether it's research tools, whether it's operational tools. What does AI look like when it's actually working inside an organization?
So, I mean, I think it looks pretty exciting. And I think that it's certainly got a place. And I think right now there's a lot of different areas where it can be helpful in healthcare. So I think what we're right now trying to play catch up on the legal side too, which is understanding, right? Understanding um where are those boundaries, and making sure that we're being safe there. But definitely, helping with some of those phone calls that are maybe the front desk can't get to. I know that that's been just so helpful, just getting those overflow phone calls, and so people can now take a lunch break where people were not getting lunch breaks for years. Just, that's amazing. That's one. Just a lot of those sort of immediate needs, I think, has been really helpful, that we're dealing with. And then I think we're slow stepping it into that. Something else that's a product that this is an eClinical Works product. It's called Suno. That it listens in the background, and then it picks up what the physician is saying, and we'll put it into structured data into the patient's chart or whatnot. So, like, if we're just sitting here talking, you're the physician, and you said, okay, your BMI is whatever, and your blood pressure is whatever, it would just put it into the note. which is great, you
Yeah.
know? Yeah, you just check it off later. So you would have to say that this is correct, but in any case, it would recognize that that was the information you were looking to put in there. So it really is quite accurate.
Yeah, it's really incredible what's going on. In automation, I think you nailed it. To the extent that it improves efficiency, it's in automation, it's fantastic. It clearly doesn't eliminate the need for strong governance, clear workflows, accountability, and I mean, where it comes up for me is, the AI tools are great, but it collects a ton of data, right? It collects data on its actual function and how it self develops and trains itself and so on to improve as a product. Um, so in some of these ways, it can make things like compliance, workflows, accountability even more important. What role does workflow standardization, and we can think about this in terms of large organizations or smaller, but typically as you grow and you scale, standardization becomes of workflows becomes more difficult. Controls more difficult to enforce and to make sure that are in place. But what is that standardization? What is that role, and how does it help in reducing risk?
So I think that that's a battle that we're always fighting. You
Mhm.
know, I think we continue as an organization, as whether they're, it's leaders, it's directors, what have you, are continually trying to have those conversations and saying, how can we make this easier? How can we make this more user friendly for the team? So that those can happen, whatever those workflows are. And that is a conversation or a meeting that I'm having every day.
Right.
What depending on what, team it might be directed at, that is an actual conversation that I have every single day. So, because it is that important, you
Yep.
know? And so I couldn't agree more. And it's something being worked on, and I'm on it too, and we're all on it because, it needs to be done accurately, and we want it to be done efficiently, and all of those things. So any feedback that anybody wants to provide, we're definitely all ears too.
Right.
Yeah, yeah.
Absolutely. No, those
I
are
don't
good.
yeah.
Yeah, excellent. And so as we talk about AI and scaling and technology, I like to kind of wind things down every episode with what future looking. What is it? As you look across healthcare today, a lot of organizations are still working through some of these foundational issues while also preparing for what's next, which makes me curious about your thoughts in terms of where the industry is heading. What trends in healthcare operations are you most focused on right now? Is it growth? Is it acquisitions? Is it technology? What are the biggest trends?
I think for I would say our organization, for organizations that I work closely with, I think we're focused on technology and growth in those areas and spanning in those areas. I mean, as you know, and as we talked about here today, um, not just AI, but certainly AI is really what's happening, and it's so much untouched here. We just don't even know what's possible. So there's that. But also with the new systems that we were putting into place, not just my organization, but again, ones that I'm working with, um, there is always something new that we can add on. And that is what is so great about really building relationships with these partners that we're working with,
Mhm.
because we are literally building onto our systems. It's like if we can dream it, like we can build it together. So and that is what is amazing about doing these kinds of projects, because that is how we get to these next phases and can help more patients and all of these things together. So whether we have our physician leaders and think groups together, just kind of and then that's how it all can work. I really believe that. I feel strongly about it.
Yeah, excellent. But you've been a part of a lot of these teams, these organizations, and as you think about just what you described on the focus of technology, where do you think organizations are underestimating risk in these areas?
Well, I think that I think burnout is a real thing, and I wrote an article about it not too long ago. I think the risk of we talk a lot about physician burnout, and I think that that is real, and I think that there needs to be some attention paid to other team members, probably whether it's administration, whether it's nursing staff. I mean, everyone else is really on that team too. And I think that they're just everyone on the team is susceptible to burnout, is what I'm saying. Everyone that, because when we pull these big initiatives off, you know, we were talking about who's in the room, who's in the room. A lot of times it's the same people.
Yeah.
A lot of the times it is the same people, and those people are gonna be the ones that are, they're gonna get a little tired. So,
Yeah.
you
Yeah.
know, that I think, that's where we need to sometimes be wary of how much are we asking of those people and making sure that we have the proper resources in place. So I would just, be aware of that.
Yeah. Excellent. That's great insight. Um, when you think about maybe looking at the future, 5, 10 years from now, what differentiates high performing healthcare organizations? Is it how they use tech? Is there something different? What do you think will separate them?
Yes, basically. I think that that was a very good question that you just posed at me with an answer already embedded inside of it. So I would say absolutely. And I think that I in part answered it a few minutes ago when I said, working with those proper partners, making this right selection too ahead of time. And whether it's eClinicalWorks, I believe it is. eClinicalWorks is a great partner for us. Also, happens to be one of my favorite EHRs, but also because they are the kind of people. I mean, again, when I first started out of graduate school, I built a report with one of their resources that did everything I needed it to do for a CMS project I worked on. It was my first project, and I thought this is amazing. They have let me do something I wanted to do. Now it's made my life so much easier, and now other people can benefit from this. And I feel like that kind of success can other people can benefit from it, and I feel strongly about that. So, long story short, here what I'm saying is, if you pick the right partner, it can be beneficial for everyone. Hopefully that's a good question.
Yeah, no, absolutely. So picking the right partners for sure. And like how these organizations utilize maybe AI from a clinical standpoint, maybe
Or
certainly from an efficiency standpoint on the administrative side, and
def
just in terms of cutting costs and improving
and I
operation
yeah,
care.
and also, not being afraid to say, something here is not working for our team, and we need to find maybe who on your side can help us with that. So we're in this together. Let's make sure that we can get that worked out, because a lot of times there's going to be problems there are just problems along the way, and that's okay. As we can work this out, we need to make sure this relationship is going to work for many, many years, because when you're in a contract with somebody, I mean, what is it? I mean, this is a marriage, so we're gonna be in it for what, like 10 years. So let's make sure that we have a good team on both sides working together. And I think that's so important. Yeah.
Yes,
Yeah.
absolutely, excellent. Well, Melissa, this has been very insightful. I really appreciate your insight and expertise. It's been fantastic, and I've learned a ton. Before we wrap up, I want to switch gears and do a quick lightning round. These are short answers, first thing that comes to mind. But before we get there, as we all know, Lightning Round today is brought to you by Western Associates, which specializes in high quality brand merchandise people actually keep and do not throw away. If you're thinking about upgrading your organization's brand through custom products, check them out at westernassociates.com. I am just happen to be wearing my firm logo shirt from Western Associates, and they do high quality stuff. So please check them out. I'll drop a link in the episode description as well. Well, Melissa, so three lightning round questions. One metric healthcare leaders pay too much attention to.
I would say they're all very important. Um, I would
So
not.
fun. They're all important.
No, I wouldn't. I wouldn't. You got a data nerd on your hands, so I'm not gonna. Sorry, you got the wrong one on that.
No, I mean, but you bring up a great point. Data is valuable, and especially these days more than ever. So if there's a metric measuring something, uh, maybe it's not right for every decision, but certainly for some decisions, it
The
makes.
lightning round and already causing you problems.
It's
My
hard.
boss and I today we're trying to cut down between 7 reports and we only got to 5, so I think I can't.
Okay, all right. Lightning round's already bombing. Oh, one thing administrators misunderstand about physicians.
The lightning round is terrible for me. I think we, misunderstand a lot about each other, to
Yeah,
be um, but I think at the end of the day, we both want the same things for, and both care about patient care. So, physicians are, I think that that's the end of the day. How about that?
there you go. There you go. One quality that separates good leaders from great leaders.
Their ability to listen.
Oh yeah. That's tough. That's I totally agree with that. I,
Yeah.
th- that's a great answer. Excellent. Well, hopefully the lightning round wasn't too bad.
Lightning round.
I think it's a great one. Great one. I think listening is really important. Melissa, again, this has been a fascinating discussion. Really appreciate your time. You provided a great perspective on what it actually looks like and what it takes to move from strategy to execution in complex healthcare organizations. Appreciate your insight and expertise.
Thank you for having me.
Yeah, thank you. Take care.
Bye.
I want to thank Melissa for her time today. It was such a great conversation. A few takeaways really stood out to me. First, successful transformation isn't about implementing new technology, it's about aligning people, processes, and systems around a shared vision. Even the best strategy will fall short without disciplined execution. Second, data, AI, and enterprise systems are only as effective as the workflows they support. Technology should enhance how care is delivered, not force clinicians and staff to work around it. And finally, high-performing healthcare organizations don't succeed because they have the newest tools. They succeed because they build cultures of accountability, collaboration, continuous improvement that allow those tools to deliver meaningful results. Again, thank you, Melissa, for sharing your experience and practical insights. I think our listeners will walk away with a much better understanding of what it really takes to lead transformation in today's healthcare environment. At the end of the day, healthcare transformation isn't measured by the systems an organization installs. It's measured by whether those systems help people make better decisions, work more effectively together, and ultimately deliver better care for patients. This is Health Law Pulse.